My pep talk today is entitled Safety Promotion Program Against COVID-19, Avoiding COVID-19 Infection at All Cost. There is a COVID-19 pandemic going on in the Philippines and in a lot of countries all over the world since March 11, 2020, as declared by the WHO or World Health Organization. As of May 7, 2021, the Philippines has more than a million cases of COVID-19 and more than 18,000 patients have died from it. COVID-19 is a preventable infectious disease, thus it is not worth dying from it. All of us must know how to avoid getting infected with COVID-19 at all costs, as once you get infected, you carry a risk of dying from it. Nobody can predict with 100% certainty whether you will recover from the COVID-19 infection or not once you get it. Remember, COVID-19 is 10 times deadlier than influenza, and the course is unpredictable and treacherous, especially for the older people and those with concomitant chronic medical diseases like diabetes, heart disease, hypertension, asthma, and other respiratory diseases. To have a safety promotion program against COVID-19, know first what COVID is, or COVID-19 is, how it spreads and gets to you, what are the symptoms for you to recognize it, and what are the ways to avoid getting infected with it. COVID-19 stands for Coronavirus Disease, discovered in 2019. COVID-19 is caused by SARS-CoV-2 virus, a respiratory virus. As such, spread is from person to person, mainly through the respiratory route, after an infected person coughs, sneezes, sings, talks, or breathes. Persons infected with SARS-CoV-2 may be symptomatic or asymptomatic. Asymptomatic persons can also transmit the virus to other people. There is a range of symptoms for COVID-19 that is hard to differentiate from influenza and other respiratory tract infections. The range of the more common symptoms of COVID-19 appearing singly or in multiple combination consists of the following: fever, dry cough, tiredness, sore throat, colds, headache, body pain, loss of smell, loss of taste, diarrhea, nausea and vomiting, skin rashes, red eyes, difficulty of breathing, etc. How not to get infected with COVID-19? The most effective preventive measure is to avoid exposure to the virus and to stay away from the virus. Avoid exposure to people with possible, suspected, and confirmed COVID-19. Avoid exposure to plenty of people with possible COVID-19. Avoid exposure in a community with a COVID-19 outbreak. At this time of COVID-19 pandemic, consider all people to have possible COVID-19, even if they don't manifest symptoms of COVID-19, and even if they have a negative COVID-19 test. Do not go near them. Stay away from them. Stay away from the virus that they may harbor. If for one reason or another, face-to-face interaction cannot be avoided with individual persons with possible COVID-19, do the following: wear masks, face mask, and a face shield when interacting with every person with possible COVID-19. Practice physical distancing with at least 6 feet away to every person with possible COVID-19. Interact in an open, naturally aerated space, not in an enclosed room, not in an air-conditioned room. Interact in the shortest time possible, no more than 15 minutes. Wear additional personal protective equipment or PPE if face-to-face interactions of 15 minutes and physical contact cannot be avoided. Practice hygienic measures of washing hands after touching things handed from another person and taking a bath right after doing face-to-face interactions with people with possible COVID-19. Another safety measure: avoid at all costs complete face-to-face interaction with persons with suspected and confirmed COVID-19. Stay away from them. Stay away from the virus that they may harbor. Still another safety measure: prophylactic measures should be added to the preventive measure of avoidance of exposure to the virus. The most effective prophylactic measure to prevent development of COVID-19 disease in case exposure cannot be avoided is building and maintaining host resistance against COVID-19. Currently, there are three effective prophylactic measures. One, building and maintaining your innate immune system. Innate means inborn, native, naturally existing immunity in the body. Number two, controlling all existing chronic medical diseases such as diabetes, heart disease, hypertension, bronchial asthma, and other respiratory diseases. Number three, building and maintaining your adaptive immune system. Adaptive means specific or acquired immunity, such as formation of antibodies to fight against a foreign body or antigen. For building and maintaining your innate immune system, practice living a healthy lifestyle, which consists of adequate rest, nutrition, hydration, exercise, stress management, and personal hygiene. Rest. Have at least 8 hours of night sleep with afternoon siesta as much as possible. Nutrition. Eat healthy natural diet, adequate but moderate in amount, balanced and varied. There is no need for additional vitamins and other supplements. Hydration. Drink at least 8 glasses of water per day. Exercise. Exercise at least 1 hour a day, distributed over the day, walking and stretching and flexing exercises. For controlling all existing chronic medical diseases, follow the medical advice of your current physicians and make sure they are all under full control. Take note that persons or patients with existing chronic medical diseases are at higher risk for severe COVID-19 diseases and death. For building and maintaining your innate or your adaptive immune system, have an anti-COVID-19 vaccination as soon as available to generate antibodies against COVID-19. Take note that vaccination has been shown to decrease the risk of severe COVID-19 and death at best. Aside from this, vaccination has been shown to decrease the number of COVID-19 cases as actually experienced in Israel and other countries. An important advice, even after vaccination, one has to continue practicing the physical preventive measures and building and maintaining the innate or natural immune system until COVID-19 is fully or totally controlled in the community and in the world. So take away in this pep talk, one, COVID-19 is a preventable infectious disease. Thus, it is not worth dying from it. Two, avoid COVID-19 at all costs, as there is always a risk for death once infected. Three, the most effective preventive measure is to avoid exposure to the virus and to stay away from the virus at all costs. Fourth, the most effective prophylactic measures to prevent development of COVID-19 disease in case exposure cannot be avoided. One, building and maintaining your innate natural immune system. Two, controlling all existing chronic diseases. And three, building and maintaining your adaptive immune system through anti-COVID-19 vaccination. This ends my pep talk. Mabuhay!